I now welcome Dr. Ajit Poddar, and he will be speaking on the probabilities and options you have if you are in a job. It may be a government job or it may be a private job. For example, he is in a private job in a NGO hospital as the medical director, one of the senior most posts. Dr. Maushmi has just become the principal of a medical college. Dr. Sudhir is in a medical college. I am a private
Can you make it
practitioner.
in a
Dr.
presenter
Subhash is a
mode?
private practitioner with a
Presenter
family
mode?
of doctors, and Dr. Tejas I just told you about him. So all of them at their places are at their peak in different kind of work area.
Good afternoon, everyone. And at the outset, I'm extremely thankful to Dr. Rajan Anand sir for giving the opportunity. And I'm 53. And when Rajan sir offered me, you speak about the Club 60, the road ahead. Actually, I had never planned my life and career very well. So the first time I became scary. So the most of the talks may not be with our own experience. It may look like a theoretical, but there is a lot to learn from it. So the first thing is that there is no such thing like one life and one career. At the age of 60, the second career starts, and this career has a lot of happiness and a lot of happening with a lot of time in your hand and a lot of money also. So you may have a second career now. So being in the job, it's the most difficult thing. Being in job is like selling your soul to the nasty corporation. And society has its own bias towards the self-employment or your entrepreneurship has a more glorified than being in the job. But not everyone has the capacity and connection and access to the resources or the drive to become an entrepreneur. So its job is perfectly okay. And being in the job is how do you position yourself? At career at 60, you should ask so many questions, and the previous speakers have already spoken. But recently I met, he was a researcher in the organ donation, Dr. Satyavrat Sharma, 2 days before. He was 74 years old. He told me the two things, the money and health, that is a detrimental for the decision regarding retirement. So the first thing is that at this age, beyond 50, you should start thinking about the retirement, and this is a time to reboot your current practice. Whatever you are doing, how can you strengthen it, reinvent yourself, and rewire your life for the next 2 to 3 decades that you will live. Aging is inevitable, feeling old is not. And there is a fourth R, that after 60 you rediscover your passion, what you could have not done because of so many things, so many liabilities, so many things for the earning money. So in job, what are the benefits? Definitely there is a guaranteed income. There are so many employees benefits in the government job. There is a career opportunity. There are a lot of that training available in the job. And you have a less liability. You have not invested a lot in your practice. So you have time to plan for retirement. And there is a study that the millennial doctors prefer employment over the private practice. This is a Medscape survey. But definitely there is a limitation in the job, the insecurity, the exploitation, the value compromises, the conflict with the employer or the co-workers. You have a lack of freedom, the authority, and there is a burnout. So there are a lot of uncertainty. I used to think if there is so many uncertainty, then why should we plan? Because there are so many uncertainty, then you should plan. So if you are in a job, the best thing is to capitalize on your existing skills and network. Keep your skills sharpened and make the most of every opportunity and resources. You may not have, if you will have your own practice later on and wherever you want, you may not have all those equipments, all those library, the rich library, the auditorium, everything, the training facility, you may not have, the simulators. So use that. And this is the best time to invest in your skill sharpening, training. And investing in the training is the best invest, and invest in your health also. So once you plan to transit, you should have a clear-cut plan. You should have a clear-cut reason. Why do you want to leave the job? Whether you want to retire, or you want to resign, or you fear layoff, or you fear some kind of thing that something is going on, some messy you perceive. So quit with a purpose. And you should have a viable plan. And always avoid a bitter breakup. COVID has taught us a lot. The employee stress levels are all-time high as per the 2020 search. If you are in a doubt, take a sabbatical to test the water. What will be life after you leave the job? So the most important thing is the financial planning. So start early. And if you have not started to invest, it's never too late. Saving is also a kind of income. So save more, spend less, diversify your fund. Financial things has already been. You must have an emergency fund for any mishappening, because you never know what will happen. And there be a source of passive income, because whatever we earn, we invest our time and skill. But there should be a source of passive income where you don't invest your time, but money should come up. And retire debt-free. There are various phases of retirement. And another important thing that Dr. Tejas talked about the non-fiscal, non-financial. You invest in your friends, you invest in family, you invest in your relatives. And because when you leave the job, only your boss changes. One which have hired you and the other who married you. So there is a trend in the UK, become a financially independent and retire early. So when you if you are a financially independent, you can retire early. And there was a study in the UK that if you retire early, you will live longer. And definitely you can delay your retirement. And it's not the age of the employee, but how much value the individual is able to add to the organization, that matters. And the best thing is you transition into the retirement gradually. You can choose, if ophthalmology is your passion and if you feel valued, if you don't have any interest other than ophthalmology, then you can reduce your work. Because at certain age, the cognitive level, the reflex decreases. So you can choose to teach, you can choose the mentorship things, you can become a part-time, you can reduce the working hours, you can reduce the complicated surgery. You can choose to become a professor emeritus if you are in a government job, or you can volunteer for a social service. But if your ophthalmology is not your passion, then you can go into the admin or a management or leadership role. So it's all about how do you repurpose your career, how do you realign your career, and you can have a clinical career alternatives that we talked about, or you can have a non-clinical career alternatives. Like you can choose to be whatever sir told, the gardening, you can do the gardening, you can do anything that you like, some go for the photography, some do the whatever. And you can choose to work at the same place that you were working, or you can choose another workplace. So if you choose to remain in the same profession, and most of the ophthalmologists, they don't have other passion besides ophthalmology. The doctors usually are very, very, very die-hard and dedicated to their own profession. So if you need to choose the existing setup, then you need to downskill your ambitions. You will have to, so be realistic, because you can't, at this age, if you are not performing, you can't have the same skills of the employer may not provide the same thing that they used to provide while you are performing. And it always happens. Today you are a star performer and you don't know when you will come under the chopper. Because today you like your job, but after 5 years nobody knows what will happen. And if you need to start your own setup, then you should learn to how will you compete with the next gen ophthalmologists, the cutting edge competition. Because the older generation of the ophthalmologists, they have a different kind of practice. And today there are a lot of marketing, the digital marketing, the social marketing, and we may not be so good at that. These are the two ophthalmologists. The first one, Dr. Howard Saj, he was an acclaimed vitreoretinal surgeon in US. And he changed the profession and he became a photographer, and he has published 20 books on the photography. And everyone must have been aware of the Dr. G. Venkataswamy. He retired at the age of 59 from Madurai Medical College. He was in the army, then Madurai Medical College. And he founded the largest eye care system, Arvind Eye Care System, at the age of 59 years old. This is a book written by the ophthalmologist, retired right. And in these books, there are 8 commandments: an ability to plan ahead, a positive attitude, an acceptance of change, the support network, a sense of purpose, a healthy lifestyle, an enjoyable leisure activity, and some kind of spirituality, have faith in God. So growing old is a blessing. Planning for change, dealing with the change, challenges of slowing down, and acceptance of the change. The happiest people don't have the best of everything. They just make the best of everything. Live simply, love generously, care deeply, and speak kindly. Thank you.
Thank you, Ajit. You are much wise even before 60. So you will have a happy